Healthcare for All is a nonprofit advocacy organization working to create a healthcare system that provides comprehensive, affordable, accessible, and culturally competent care to everyone, but especially the most vulnerable among us. We want to welcome our friends from the Save My Care bus to Boston. Save My Care has been traveling across the country on this bus to lift up the stories from those most affected by the threats to health care. Since January, we've been fighting against congressional attempts to repeal the Affordable Care Act and dismantle Medicaid. Here in Massachusetts, we are deeply grateful to Mayor Walsh, Congressman Kennedy, Governor Baker, and the entire Massachusetts congressional delegation who have been strong and consistent voices focused on protecting consumers and keeping these federal programs strong. But this fight is not over. You will hear from people today whose health coverage is at risk, along with providers, elected officials, and other champions who are working to protect our care. So first, I'd like to introduce the Mayor of the City of Boston, Marty Walsh.
Thank you very much, Amy, and I want to thank you for coming here today. I also want to thank Congressman Kennedy, Anton Gunn, who's here for us as well, and all the speakers that are with us today. Thank you for coming to our city here to speak on this important issue. I want to thank Save My Care for coming to Boston today. This group is concerned, a passionate group of people who came here after the election to protect our national health care system, and that's something that's important. And while Congress has been out of recess, Save My Care has been driving across our country, amplifying the people's stories and sending messages about health care being a fundamental basic human right. And I want to thank you for that. I also want to thank the Massachusetts delegation for standing up for health care, but just standing up for every single thing that's been going on here in this country over the last year and a half. We need to keep we should clap for them. They've been incredible. And we need to keep this momentum moving forward. The ACA, as you all know, has survived several attempts on taking its life, quite honestly. And we're going to continue to fight so that plug does not get pulled. But one thing that's scary, the fight's not over. The future of our national health care is still in danger. And we know how people are going to suffer if the ACA is repealed. We heard the stories. Those are real stories. Caps on premiums, barriers on pre-existing conditions. Vital care is going to be stripped from our seniors and low-income people and other vulnerable populations. Access to birth control for over millions of women is in jeopardy. Rollback on Medicaid and addiction treatment in the middle of a national epidemic. We're seeing what's happening in Houston right now. And the only thing that's a guarantee for the folks of Houston is that when they walk into a doctor, they have health coverage. Their life's turned upside down. Sometimes when you have a sick child or a sick parent, your life gets turned upside down. And not having to worry about the expense because you have insurance is a relief for people. So we want to keep that in mind. This might sound dramatic because it is dramatic. Healthcare hurts our entire country. If we can't have a strong economy, if our workforce isn't healthy, that's not going to happen. We're going to feel those effects here in the city of Boston. Oftentimes in Boston we say, well, it's not going to happen here because we're home to world-class hospitals. We all know that. If the ACA is repealed, we will lose jobs in Massachusetts. I'm confident that our legislature will step up and because we were the first state in the country to have universal health insurance, but it will be different. It will affect our economy. It will affect our businesses. It will affect what's happening in our city. And the world will also potentially lose life-saving medical breakthroughs that are happening here in our city. I can honestly say today that I wouldn't be here today as mayor of the city of Boston or even on this earth if my family didn't have access to good health insurance when I was a kid. Because at the age of 7 years old, I was diagnosed. I suffered from Burkitt's lymphoma, a rare form of childhood cancer. Back when I had it, the survival rate was low. 40 years later, the survival rate is 90%. Why? because kids like me were taking the experimental drugs that allowed the doctors to get the right formula to make sure that 90% of the kids that get Burkitt's lymphoma today survive. But it's the life-saving treatment that I received in Boston in the cutting-edge hospital that allowed me to survive. It also, by the way, ironically, was my father, who worked for the laborers union, had health insurance. And that didn't cover all the bills, but it helped them with the extreme medical costs at that time. I'm just one example of health insurance in Boston and one example of cancer care in Boston. Think about the millions of children and families that rely on Medicaid and other forms of health care every single day in this country. Children who are fighting against all the odds. They're fighting for their lives. And as a nation, we cannot and should not and will not fail them. I hope that the Republicans and the Democrats will find a way to come together in this issue, because this is bigger than the president. This is bigger than the Congress or any branch of government. It's a moral issue. We're going to continue to hold them accountable. We're going to continue to fight along with champions like Congressman Kennedy behind me. We're going to keep telling our stories, so there's no way that members of Congress, and when I say this, I don't mean our delegation, I'm talking outside of our delegation, can ignore it. I want to thank you all for being here today, and I truly do appreciate Save My Kid. Thank you for coming to Boston, and I'm going to turn this back over to Amy.
Thank you so much, Mayor Walsh, for not only your leadership, but also for sharing your personal story. Next, it's my pleasure to introduce a real champion in Washington, D.C., who's there speaking for all of us. Please welcome Congressman Kennedy.
Thank you. Mr. Mayor, thank you for having us this morning. Thank you for your inspiring words, and thank you for your leadership and stewardship of this city. To Save My Care Coalition, to Healthcare for All, to the activists, to the advocates, to the parents, to the patients, to the doctors that have made today possible, that are here with us this morning, that made certain that our country stood up to a misguided and painful debate over healthcare, and that we stood for each other. A profound and deep thank you. We are seeing across the news today the devastation that is transpiring in a great American city in Houston. We're seeing folks that have done absolutely nothing wrong, whose sky has literally fallen on them. Devastation and destruction that is indiscriminate. Weeks and months and years of rebuilding that is going to be necessary. And you're seeing the extraordinary generosity, the courage, the compassion of its citizens and of citizens from around the nation come to their aid. From cities and states that are now sending volunteers down to help, from communities like Boston and Massachusetts who have sent donations into the City Hall behind me to try to provide some measure of assistance. Those floods, that storm, shows what happens when people, good people, decent people, hardworking people, can be victim to something beyond their control. And what happens when a society comes together and says, we will be there for you. As it is in Houston, so it should be in healthcare. Because that's what our system is supposed to be about. Not how we treat the strong at their most mighty, but how we treat those when their own sky has fallen, when they are shaken, when they're at the moment of deepest need. Will there be a system to support them? Will a neighbor come to support us, to give you a shoulder to lean on, and to help pick you up so you can go forward? Your family can go forward. You can collect yourself and pull yourself together for another day. That was the debate we had this summer, and that was the resounding message that this coalition gave voice to. The stories collected on that bus, the stories transmitted to Washington, of people standing up and saying, you can't do this to me, to my family, and to my neighbor. That's what this debate was about, the content and character of our country. And because of you, because of some of the parents and the children behind us, our country came off better for it. But this debate is not over, and this risk is not gone. As one of your members of Congress, I'm here before you to say, please keep your voices up. Keep them raised. Make sure that we continue to speak out for the family next door and for ourselves at some point, because the great equalizer amongst us is that at some point, that sky will fall on every one of us, just as it has on the folks in Houston. Thank you all for being here. Thank you for having me.
Thank you so much, Representative Kennedy. It is now my pleasure to introduce Angela Ortiz, the mother of a child with special health care needs and the founder of the Massachusetts Pediatric Home Nursing Care Campaign. She's going to share her story about why access to Medicaid is so important for the health of her daughter and her family.
Thank you, Amy. My husband and I were so excited to be expecting twin girls 4 years ago. We didn't know if we would ever be able to have children due to his leukemia diagnosis back in 2010. We were eager to end a very scary chapter in our lives and start anew. Little did we know that we were about to travel down the most heart-wrenching path. Ayla, our baby bee, was immediately whisked away to the NICU. She was a shade of blue and did not make a sound. To have one of your newborn babies fighting to survive was unimaginable. She needed heart surgery at 3 days old, and that would be the first of many uphill battles. Her diagnosis of Townes-Brocks syndrome resulted in her having a heart defect, cleft palate, critical airway, low vision, hearing loss, and needing to be fed through a feeding tube. She has had over 250 medical appointments, 25 hospitalizations, 5 surgeries, and she is currently followed by 18 specialists. She is one of Massachusetts' most medically complex children. Beyond all of this, she is still a child with her own personality, interests, and feelings. She is at the center of our family, inspiring us and giving us greater purpose. This road has not been an easy one, but there is one thing that has kept our family afloat, and that is Medicaid. And although we have private insurance, Medicaid is what pays for most of Ayla's interventions, life-saving equipment, specialized formula, medications, and all of her 60 hours of skilled nursing at home. Medicaid is our lifeboat, and I can't even bring myself to think of the devastating domino effect it would have on Ayla's life and our entire family if we didn't have it. At a time when the GOP is shamelessly working to strip this away from us, I am reminded of the strength behind Ayla's name, which means oak tree, and the encouragement poem by Johnny Ray Ryder Jr. that has always given me fortitude. It reads, "A mighty wind blew night and day. It stole the oak tree's leaves away, then snapped its boughs and pulled its bark until the oak was tired and stark. But still the oak tree held its ground, while all other trees fell all around. The weary wind gave up and spoke, 'How can you still be standing, oak?' The oak tree said, 'I know that you can break each branch of mine in two, carry away every leaf, shake my limbs and make me sway. But I have roots stretched in the earth, growing stronger since my birth. You'll never touch them, for you see they are the deepest part of me. Until today I wasn't sure of just how much I could endure. But now I found, with thanks to you, I'm stronger than I ever knew.' So, let this serve as a message that no matter how hard their wind blows in trying to take away our health care, we will still be standing strong with our roots firmly anchored in love and compassion. Thank you.
Thank you so much, Angela, for sharing your powerful story, your advocacy work, and your beautiful daughter and family here with us today. Next, we invite Rhoda Gibson, a disability rights advocate and Mass Health member, to share how important Medicaid is to enabling people with disabilities to remain independent and in the community.
In 2007, I thought the world was mine to take. However, in 2009, right before double knee replacement, I was diagnosed with fibromyalgia. In October of 2011, I got an infection down my spine and became an incomplete paraplegic. I went from making to close to $80,000 a year and opening my own business to barely making it on SSDI. Fortunately, I have friends that would not let me lose my spirit. In 2012, Medicaid in Massachusetts provided the services and supports I needed to live independently in the community. Key word being live. Without my Medicaid, I will lose my Section 8, PCA services, medical equipment and supplies, and all the things I need for basic activities of daily living. Without my Medicaid, I will lose my independence and ability to advocate. Without my Medicaid, I will be imprisoned, not by bars, but by the institutional bias and constraints of a nursing home. Help us save my care and free our people.
Thank you. Thank you so much, Rhoda. It's now my pleasure to welcome Loretta Johnson, Secretary-Treasurer of the American Federation of Teachers and a Vice President of the AFL-CIO, to share her insights.
Good morning, and thanks to the grassroots activists and resistance we've seen around the country, we won an important battle in the Senate last month. So first, I'd like to thank everyone here and the millions of Americans around the country who fought the GOP plan to sabotage our healthcare system. The fight is not over, though. Republicans are still committed to stripping healthcare away from millions of Americans just to score a political point. We know that President Trump and Republicans in Congress remain determined to take away health care, no matter how reckless it is or how many millions of Americans it would hurt. We know it because after failing to pass his partisan health care bill, President Trump is still threatening to cancel subsidy payments that will help 7 million lower and middle income Americans to afford their insurance. So, it's just as important now as it was over the last 8 months that we remain awoke, that we harness and build on the energy of grassroots level to thaw any future attack on the ACA, whether it's choosing not to fund it or subsidize or outright repealing the entire law. We're here today because we won't let Republicans turn back the clock to the time when Americans were one pre-existing condition or illness away from bankruptcy. As the nation's second largest teacher union and nurses union, representing more than 130,000 healthcare professionals and nearly 1.7 million members in total, our members see the positive impact of the Affordable Care Act every day in their classrooms, in their hospitals, and their communities. Our members see what happens when patients delay or forego medical care because they can't afford it. They get sicker and they have poor outcomes. Nurses and doctors have an obligation to advocate for their patients, educate them about the disease prevention and management, and treat the whole person so that people can thrive and contribute to their communities. Unfortunately, the GOP healthcare bill undermines our ability to deliver our promise to provide quality to all our patients. There's a reason every major nation physician and public health and hospital organization opposes the GOP plan. The proposal would be a disaster for American families. It raises coverage, weakens productions, and ends Medicare as we know it. The plan would cut $13 billion in federal Medicaid contribution to Massachusetts over the next decade. The plan would put more than 409,000 Massachusetts at risk of losing coverage, more than 6% of the state population. Those losses would be felt hardest by most vulnerable population, endangering the health care of 55,000 children and 34,000 people in disability. There's a reason we call this bill cruel. The plan would slash the $73 million that Massachusetts schools receive each year through federal Medicaid funding, which cover crucial special education service to students and disabilities. For nurses and healthcare professionals, this bill would mean sicker patients, less funding for the hospitals for parents of children with special needs. It would mean losing school-based services and keep their children safe and healthy. For people with cancer, diabetes, asthma, and other pre-existing conditions, it would mean skyrocketing premiums. So our message is clear. We will not forget the GOP voted time again to strip health care from millions of Americans. 217 Republicans in the House, 49 Republicans in the Senate will cut our care, and we will hold them accountable. Instead of undermining Americans' health care, President Trump and the GOP should work with the growing number of senators and representatives from both parties that want to fix ACA. And it's our responsibility to keep up that pressure on the lawmakers until all Americans can access high-quality, affordable health care. Thank you.
Thank you, Loretta. I'd now like to introduce Dr. Destiny Tolliver, a provider at Boston Medical Center and Boston Children's Hospital and an active member of Doctors for America.
Good morning, everyone. My name is Destiny Tolliver, and I'm a pediatric resident physician at the Boston Combined Residency Program. So I take care of children and families, as she said, at Boston Medical Center and at Boston Children's Hospital every day. I've provided care to hundreds of children and families for everything ranging from routine checkups to prolonged hospital stays. And my patients range from Boston natives to people from all over the country and from all over the world who come to Boston seeking excellent care. One patient that I've seen recently has complex medical needs that were identified soon after birth. He's less than 2 months old, and already he needs special formulas, medications, frequent lab testing, and follow-up with multiple subspecialists. With access to health care and good care coordination supports for his family, he has the potential to thrive and do well and grow up. Another patient I care for was born 3 months early, and he required a breathing tube and a feeding tube. But with the excellent care that he received in the neonatal intensive care unit, he's now a healthy, active toddler running all over the exam room, coming in for his vaccines and for his routine screening, as well as for the occasional cold. Both of these children are covered by Medicaid. Medicaid provides health care coverage to 30% of the children in Massachusetts, making it the largest single insurer of children in our state. So when I hear about policies that threaten Medicaid coverage, I think of the children I described for you, as well as many of the patients I see every day who rely on this coverage to access the care that they need in order to grow up healthy and strong. When I hear about people trying to repeal the Affordable Care Act, I think of my patients who were born with pre-existing conditions or who met their lifetime limits on insurance coverage before they even left the hospital for the very first time. And when those who would repeal the Affordable Care Act say that, or try to make it seem like it won't harm children, I think about the families who are put in the position of having to choose between housing, food, and the medications that we prescribe because they're struggling to make ends meet. No parents should have to choose between their own medications and making sure that their children are healthy, have a healthy meal, and have a roof over their heads. Medicaid and the Affordable Care Act work together to bring high-quality, affordable care to these families, to my patients. And I'm not alone in this. Already, millions of Americans, including healthcare workers around the country, have been working hard to stop the repeal of the ACA and halt any cuts to Medicaid. We called, we wrote, emailed, we tweeted our congresspeople, demanding that they consider the impact that repealing the Affordable Care Act would have on our patients and our families. And we made them listen when we said that access to quality health care is necessary for these families. And today I'm asking that we all commit ourselves to continuing this fight. Let's make sure that Congress and the current administration don't forget that we're fighting not just for my patients, not just for the city of Boston, but for the limitless potential of everyone in the U.S. to lead a healthy and productive life. Thank you.
Thank you, Dr. Tolliver. It's now my pleasure to introduce Anton Gunn, a former healthcare advisor for the Obama administration and a board member for Healthcare for All's partner organization, Community Catalyst.
Good morning, everyone. I am so excited to be here. Again, my name is Anton Gunn. I'm a board member with Community Catalyst, a former senior official in the Obama administration who worked hard every day to make the Affordable Care Act become a reality. I'm here today, thank you. I'm here today because I've been on this bus for the last couple days, traveling the country with great, passionate people who care as much about healthcare as I do, because it is now a right in the United States of America to have health care. It is no longer a privilege. And we're blessed to be in a city that has incredible leadership who supports health care. Mayor Walsh supports health care. We're blessed to be in a state that has a governor that supports health care. We're blessed to be in a state to have congressmen like Congressman Kennedy and the entire delegation that supports health care. What we have in Massachusetts, what we have in this city, is something called leadership. Leadership is understanding that you have to do what is right and responsible for the people that you serve. That it doesn't matter about the politics. It's not about the R behind your name or the D behind your name or the red jersey or the blue jersey. It's about right and it's about wrong. And it's about stopping wrong and doing right. And we are blessed to be in a place that has leadership that understands what the right thing to do is. Unfortunately, there are some other leaders in our nation who seem to not to understand the difference between right and wrong. And earlier this summer, in July, we had the battle of our life to make sure that the ACA is here to stay. But we need to remember, yes, we need to remember that this battle is just a battle. It is not the war. Because the President of the United States and several leaders in Congress have vowed to repeal and replace the ACA at all costs. And if they can't do it by policy making, they'll do it by rule making, by undermining the opportunity for people to get coverage. But we are here today to make sure that does not happen in this country. We are here today because we value the life, liberty, and the pursuit of happiness that we want to guarantee for every person that calls the United States of America home. Now, we can only do that. We can only do that if we understand that not only do we have great leadership in the city and in the state and in Washington, but we have great leadership standing out here watching this event. Each and every one of you is a leader. And as a leader, you have to do what leaders do to make sure that we protect health care for every person in this country. And a leader does three things. A leader serves, a leader empowers, and a leader leaves a legacy for those that come after them. Dr. Martin Luther King Jr. said, everyone can be great, because everyone can serve. So the question is, what are you doing to serve those around you in your community to make sure that they understand that healthcare is always a priority for every person? And when I say a priority, I fundamentally believe that in order for you to live out your God-given potential given to you, you have to be healthy in your body, you have to be healthy in your mind, and we have to be healthy in our communities and our cities across this country. We have to be. And so as a leader, what are you going to do to serve to make sure that stays a reality for every person, every life that you touch? We all touch lives in some way, shape, or form. So a leader must first serve. The second thing a leader does is empowers. That you empower people to be able to live out their full potential. And we empower them with the power of the vote. That if you have the opportunity to cast a ballot in this country, you should always cast it for leaders who understand their role to empower. Those leaders who will vote to protect health care for every person in this nation. You have to learn to empower. Each one of us has a responsibility to do that. And number three, it's about legacy. And when I say legacy, it's not about the time right now, but it's about all of those that come after us when we're not here. It's about understanding that we only have a limited time and space on this planet, and while we're here, we should always try to do good, and not just do good, but do great. And a legacy is making sure that every child that is born, every family that comes to this country has the opportunity to live out their potential. And we do that by making sure that healthcare stays a right for all. And I'm grateful to be in a city with leaders who get that, who understand that, and who value that. Because I fully understand and value that more so than I ever thought before. Because healthcare has not always been a right. Every person out here probably has a story, like the stories we heard today, the story of your friend, your family member, your relative, your coworker who's faced a crisis. A few minutes ago, we heard an ambulance come down the street. It was loud. And we all suspect that ambulance was either picking up someone or taking someone to get health care. And what we need to understand is that if President Trump and Congress has their way, that person may not make it because they don't have access to quality, affordable health care. But I spent the last couple days on this bus in a drive for their life, for your life, for your family member's life, for the life of my wife, my daughter, and my extended family. We have to be vigilant in this way. So we're not going to let them turn back the clock. We're going to make sure they understand that the power rests with each one of us because we know how to serve. We know how to empower. And by God, we're going to do our part to make sure we leave a legacy for those that come after us. Again, I'm Anton Gunn. I want to thank you for being here. And I want to thank this state for being the brightest light in the darkness and showing the country what it's like to provide universal health care for every person. Thank you very much.
Thank you, Anton. And thank you to all of our speakers from this morning. I think we were able to hear from elected officials, providers, other champions about the importance of working to protect our care. But now we have some action steps that we need to do to ensure that Angela's daughter continues to get the coverage she needs, that Rhoda can continue to live independently, and that millions of people across the country who rely on the ACA and Medicaid for coverage are not forgotten. So here's what we need you all to do. First, as we have said multiple times today, we are very fortunate in Massachusetts that our delegation is committed to the gains we've made in healthcare. Please take the time to call your members of Congress, your senators, and thank them for their leadership on this issue and ask that they continue to remain strong. Second, your stories are all important. Please continue to share your stories. There's a table over there where people can go and share stories. And we invite you to join Healthcare for All's Friends and Family campaign. Call your relatives and friends in other states and talk to them about why healthcare is so important to all of us. Ask them to reach out to their members of Congress and share their personal stories. And last, please visit the Healthcare for All website at www.hcfama.org to join our efforts here in Massachusetts. Or take your phones out right now and text Our Lives, one word, Our Lives, to 52886 to get connected with larger national efforts. Thank you for everyone for being here today, and we appreciate your activism and your work moving forward. Thank you.